Hey there.
Hey, how are you?
I'm good. How are you?
All right, a little stressed, but that's second year.
Oh, you guys started about Pathophys?
Yeah, we started that one.
How's it going so far?
I'm really not liking it.
Yeah, cardio is now. It only gets worse. That's the issue.
I know. It's just her teaching is not vibing with me.
I mean, I'll tell you what I did. I did really well. Like, I had honors in her class.
Oh wow.
Just, I did not listen to her. Like, I did boot camp. Did all of
Mm.
med school boot camp. I didn't follow like her pace because
Mm.
it was just too random for me. Like, I would watch all of the boot camp the first week and do all the Anki. And then I think the next 2 weeks I like read Lily, which helped
Okay.
me. I like reading Lily. Some people don't like it.
Mm.
And then I did all of our practice exams.
Okay. Yeah, I've been trying to like supplement Lily and boot camp together because it's just hard for me to read that textbook and retain anything. So I like
Yeah.
try to find the
What's up, y'all?
steps.
Can you hear me?
Yeah, we can hear
Yeah,
you.
I can hear you.
Perfect. And I can screen share unless you want to screen share. Either works totally fine with me.
How about you screen share?
Yeah, no problem.
Okay, thank you.
And you can just say next slide whenever it's time.
Okay, yeah, perfect.
We start that up. Okay.
Is that how many
Y'all
people
see it?
usually show up? Yeah.
Perfect. And I want to pause the screen share and just make sure the recording is going fine. About 3 more minutes and we'll start at 7:05. Gabby, what's up?
Hi, Yvonne. How's it going?
Doing good. I'll a little quiet. I also think my speakers are a little.
I'm joining from the car, so I'm not going to be on video, and I'm going to turn off my
You're
mic.
totally
But
good.
excited for today.
Ah. One more minute. All right. Gonna start up the sharing again. All right, and we can all see it. Perfect. For the final video, it goes on YouTube. We crop out all the B-roll stuff like this, but we'll get started. If you ever need me to just advance the slide, you can just say next slide. But without further ado, welcome everyone to our November meeting of the MSM Journal Club. Today we'll be hosting the Student Interest Group in Neurology. So Zara is going to be presenting on operating with waves, a focused ultrasounds for movement disorders. She's going to tell us all about these clinical interventions and how they're changing the scene for different movement disorders and how they might be part of our clinical repertoire or even the curriculum of tomorrow when talking about their management. Take it away.
All right. Hi, everyone. My name is Zahir Irfan. I'm an MD2 at Morehouse School of Medicine, and I'm just presenting on behalf of SIGN. And next slide. Next slide again. Okay, so my presentation is about movement disorders and one way of treating them. So movement disorders just involve like different things with a lot of extra overactive movement. For example, essential tremors, Parkinson's disease, Huntington's disease, etc. So these disorders can be very debilitating on patients' quality of lives, just because like they can't really hold their hands still, and like you don't really think about how important it is to keep your hands still just for like everyday tasks, like even like eating, drinking, like riding. So it has like a really big impact on patients, and it just really negatively affects them. And the way that movement disorders happen is it's due to abnormal rhythmic activity in motor control circuits. And these are in the cortex and basal ganglia, as well as in the cortex, cerebellum, and thalamus. Next, please. Okay, so some old solutions that we had for essential tremors are medications. So propranolol and primidone. Propranolol is a beta blocker, and primidone is it kind of stops extra movements. And the thing with medications, like any medications, is they often have many side effects. And for some medications, they're more severe. So for like these medications, there's sedation, dizziness, cognitive effects, and these can also impact the functional ability of patients and really impact their quality of life. So even though their tremors are gone, now they're sleepy all the time, they're just feeling dizzy, they're having difficulty with their memory. And also another thing is that they lose effectiveness over time. So given all these side effects, they kind of don't even work after a point. Next, please. Another treatment option is neurosurgery. So there's two different things here. There's thalamotomy. So this involves basically making like a lesion in the ventral intermediate nucleus of the thalamus. This is irreversible because like once that cut is made, you can't like tie it back together. So there is a risk of permanent side effects with something like this. And another thing is deep brain stimulation. So this basically involves like putting electrodes into the brain, and that delivers impulses that kind of help control those affected motor areas of the brain. And the thing with this is that it is reversible, and those impulses can actually be adjusted to kind of, cater it to the patient and like what works best for them. The thing with this though is that the battery does need to be replaced every so often, so kind of going back in there and replacing the battery. And it also has other side effects like numbness, tingling, and muscle tightness that just comes with like, you know, delivering impulses in areas of the brain that can have other side effects. Next, please. Okay, so this is what my presentation was about. Next. So this is MRI guided focused ultrasound. So this basically uses very high intensity ultrasound waves, like a lot of them, and it basically converges onto a single point. And that high energy kind of makes a precise lesion, but there's no need for any surgery or any incisions or anything like that. And that just destroys those circuits that are overactive. And a common target, similar to the thalamotomy, is the ventral intermediate nucleus of the thalamus. Um, yeah, so next slide. This is just a figure that I found in a paper. So it just shows what kind of happens with this procedure. So the patient is put into an MRI machine, and then you kind of look at the different areas of the brain that are overactive, and then the ultrasound waves are concentrated on that area. And the patient is conscious during this whole procedure, so the physician can kind of see what's going on and like check in with the patient, see if the tremor is getting better, things like that. Next. This is a video, if you can play it, please.
Oh, there you go.
Okay.
Excited. I told my daughter this morning, today's going to be a great day because I'm going to be able to write my name and people will be able to read it again. I remember since I was 15, going into high school, that they would ask me if I did drugs because of the way I shook. I took a 0 every day in class in high school because I would not go to the board because I couldn't write on the board. And people would look at you strange. It's something that you learn to live with. But as I get older, it's getting worse.
Most of the patients who have the procedure have had the tremor for a very long time. They have significant problems eating, drinking, writing, things that most people take for granted. The treatment is very good at controlling the tremor, and most patients are genuinely happy with it.
This is a blessing today, whether you know it or anybody else knows it. This is a blessing today. As a cup of water here, here's celebrate important. Right. The good news, we are alternating. Great. We're well. Great. Am I really? See that? Oh my goodness. Wow. They don't know how they're changing lives with this. This is something that I have. I'm 68 years old. From the time I'm 15, I remember this. And to see what amazing changes you guys are doing. Thank you. God bless each and every one of you.
Wow, that was night and day. I mean, I expected improvement. I just didn't know it would be that immediate and stark. That was pretty crazy.
Yeah, it's pretty crazy. She's 68 and she's had this since she was like 15. So like her
Wow.
whole life is just it's pretty incredible. Yeah, so like with every treatment there are complications. Next slide, please. Yeah, thank you. So there are some transient gait and speech side effects. Most of these do resolve within a few days to months. Sometimes they are permanent. And this might be just because the lesion can kind of go beyond the ventral intermediate nucleus to the medial lemniscus and other areas of the brain. Um, and there's other side effects like nausea, imbalance, paresthesia, and ataxia. And the thing with this is the lesion is irreversible. So oftentimes it's usually only done on one side of the brain just so that it doesn't have like, a really big effect if both sides of the brain are lesioned at once. Next. So there's still research being done on different ways to treat essential tremors. Um, this is just like one of them. And there might be other research that shows that there's other things that are more beneficial to treat essential tremors. But this focused ultrasound MRI does have different implications. So, like A is thermoablation, that's what we mentioned today. B is opening the blood-brain barrier to really cause targeted delivery of drugs, which is pretty cool. So it can really target specific areas through that. Neuromodulation, so just kind of changing different activities and function of the brain. Um, it can also be used to treat cancer and ablate like tumors and different lesions like that. Um, so there's many different um, implications of this technology. Next. And that's it. Thank you all for your attention. And the next slide has references.
This is really great. You honestly just gave like a really good sales pitch for neurology as a whole. This was a side of it I don't think I've actually known about. And my only question is such a random, what's it called? Red herring detail I just wanted to know about. The battery replacements in deep brain stimulation. If anyone knows this, by the way, um, do you know how often this happens? Because it's something I didn't really think about. I mean, I guess pacemakers are a similar story, and I think of those in the scale of like, I don't know, 5 years or something off the top of my head. How long do these last?
I actually just looked it up because I'm not sure either.
That's fair, yeah.
Um, but it's saying that it could be like 3 to 5 years, but some can last up to 15 years with the newer
Okay.
models.
Okay. Oh, that's not bad. I mean, especially since a lot of these movement disorders show up later in life. That's not,
Mm.
yeah, but like for example, like she had essential tremor, I guess that can show up pretty young. That can be like 3, 4 replacements throughout one's life course. So I can see that being problematic.
Mm.
Well, this is great. Thank you so much. I appreciate you rallying your group and everyone attending today. Our next presentation is going to be December 4th. We are expecting to have the orthopedic surgery interest group host that one. I don't know the topic yet, but we'll stay tuned. I'll keep y'all updated. Um, and this is more down the road. We submitted our approval for the student-led symposium. That's something we hope to have going in early April. April 1st is our tentative date. So expect some announcements about that. We're going to have it kind of be like a Curtis Parker kind of situation. Students can submit whatever research they want. We can have oral symposiums and we'll put it all in the new building. Wings will be there, research will be there, and we're going to have a great time. So thanks everyone for attending today, and we will see you next month. And cut somewhere. Stopping recording.